Good afternoon, everyone. I'm Dr. Nanda Kishore. I'm a pediatric consultant at KIMS Hospital, Secunderabad. Today, I'm going to talk about common problems in newborn babies or babies who have just been born. As you know, there's a lot of social structure change in our society of late. Because of that, the new parents or mothers are not getting help as they would have gotten a generation before, where the elderly in the family were there to help the mother to get over these common problems. Now, these days, these young mothers had to face, or young parents have to face these problems on their own. And it's quite anxious for them to take care of the babies when they don't know what is normal, what is not normal, and when to take help. So today I'm going to talk about some of these problems and mention about when to seek medical help. Okay, so let's take some of the common problems which we encounter one by one. When the baby is born, it's a joyous moment for all the family, and the baby would expect to start feeding soon after birth. And we all recommend that breast milk is best for the baby. So take every opportunity to give breast milk to the baby. And World Health Organization recommends giving breast milk within first couple of hours of birth. That means you start feeding the baby within the delivery room immediately after birth once the mother is comfortable. There are two reasons. One is if you start early on breastfeeding and that process takes easy to carry on later. And the other reason is the first 2-3 hours after birth, babies are quite active and vigorous. So they're ready to latch onto the breast. After that, they go back to sleep. And so you may get doubt. I mean, is the mother able to get enough milk production immediately after birth? That's okay. Even if mother produces a little amount of milk, what we call colostrum, which is very good for the babies, or even if the mother doesn't produce any milk also, it's always advisable to try to latch for the baby to latch on the breast so that process becomes smooth. And the other reason is as soon as the baby starts sucking, milk production will start. So one of the very good stimulus for the milk production is the baby suck. So in some situations where the mother is not able to produce milk at all, and the baby is at risk of blood sugar going low, like when the baby birth weight is low, less than 2.5 kilos, or mother is diabetic during pregnancy, in those situations, we'll advise if mother is not able to produce enough milk, give formula top-up to maintain the blood sugar levels. In all of the situations, whatever the mother produces a little amount of milk should be sufficient for the baby. And later on, after that, baby should be fed at regular intervals, anywhere between 1 to 3 hours. If the baby demanding more, give more. Otherwise, don't go more than 4 hours gap, because baby's stomach capacity isn't big enough to accommodate a lot of milk to go for that long. So there's risk of blood sugar going low if you go more than 4 or 5 hours without any feed. So always try to feed the baby within 2 to 3 hours in the first few days of life. Even if, as I said, even if mother is not able to produce milk, especially first-time mother, milk production may take a couple of days to come. So even those situations also, let the baby suck on the breast at regular intervals. And if you're worried of the blood sugar level, after the baby sucks on the breast, give formula top-up to maintain the blood sugar level. Otherwise, it's not necessary. And the milk production increases as the baby sucks. So that is the reason we say babies do not need other than mother milk until 6 months of age, even water also, to maintain the blood sugar. As the more and more baby sucks, more and more milk gets produced. And that's how the nature has designed our physiology. And breastfeeding is like active participation from both the mother and baby. So they need time for them to get used to the process and adjust, especially if the first-time mother. So if you're struggling, there's a lot of help around there. So please see your local pediatrician or a lactation consultant to help you with establishing the breastfeed. rather than going on to the formula alternative. So it's always advisable, try your maximum best to give baby your mother's milk as much as possible. In the situations where you cannot give it, or if it is contraindicated, like when mother in specific medicines where mother cannot give it, in those situations we say probably it's not advisable to give it, or mother is very sick. If mother is not able in a position to feed the baby, in those situations, it is okay to give formula milk. But any other situations is always encourage mother to give breastfeeds to the baby. And how do we know whatever the mother is giving adequate for the baby? The three ways we can know. The first one is if the baby is sucking on the breast, and they usually tend to finish feed within 10 to 20 minutes. If mother is able to have a good milk production and the baby sucking well, usually baby gets satisfied in 10 to 20 minutes. And end of it, baby gets satisfied and leaves the breast. That's one. Second one is if the baby is having enough milk intake, they usually have a good urine output. So that means they usually have anywhere minimum 6 to 8 urine output in a day, frequently more than that. And the third thing is regular weight gain. So if the baby is feeding more than 40 minutes, or the baby, even after the end of 40 minutes, baby is not happy and crying, that means probably baby is not getting enough milk. So maybe mother is not producing enough, or maybe the breastfeeding latching technique is probably not right. So we need to look into those things before we say mother doesn't have enough milk production. So, and even if the latching technique is not right, usually mother tends to have a pain in the breast while the baby is feeding. And another thing would be if the milk quantity is not enough, again, urine output would be less, and then baby weight gain will not be adequate. So if any of those situations are there, please take help from your local doctor or lactation consultant. Another thing, common thing, what happens is the babies go to sleep as soon as they go on the breast within a couple of minutes of feed, because that is most comfortable position for the baby. So once they have a little feed, they go to sleep. So in those situations, we cannot say baby had enough feed within 2 minutes. That's too early to say. So in those situations, wake the baby up. Maybe gently stroke on the back or tickle in the soles. Wake the baby up and let the baby feed. So that's the way we know whether the baby is getting enough feeds or not. Another aspect is, while feeding, halfway through feeding or end of the feeding, burp the baby. Because what happens is they tend to swallow a little bit of air also with the milk. So that air, it comes out, it's better for the baby. So to bring that air, maybe halfway through the feeding, put them on the shoulder and gently stroke on the back or end of the feeding again, so that that air comes out. In that process, some amount of milk they may vomit, but that's okay. Another aspect is the sleep. I mean, newborn babies, I would say normally is they feed, they sleep. So they sleep most of the day. They sleep anywhere between 16 to 19 hours in a day. So that means they only wake up for the feed, wake for a little time, and then go to sleep. And so as long as they're doing that's okay. And they don't have a day-night rhythm yet. What does that mean? So many babies actually, they sleep during the daytime, they're more awake during the nighttime. And day-night rhythm takes anywhere between 3 to 4 months for them to establish some kind of a day-night rhythm where they sleep through the night without any break. So what does it mean for the mother? So mother has to be awake daytime, nighttime. She'll get very little rest. And it's like a 24 hours, 7 days a week on call. So they get exhausted, pretty exhausted end of few days. So it is very important mother to be aware of these things and take rest when the baby is sleeping. And in extreme situations where mother is completely exhausted, it's okay for the mother to express milk and let somebody else take care of the baby, give that feed, so that mother can get at least some amount of sleep during the night time. I'm not saying give a formula milk, give mother's milk expressed and give it. So it's always trying to encourage give only mother's milk where it is feasible. Another thing, what we see in our practice is excessive cry. Babies, for anything, to small things to big thing, the only way they can express is cry. So it's our thing to assume what is the reason for cry. And most common reason for cry in the babies is hunger cry. So they're hungry, and then once you give feed, they settle down. Another common reason is either you have a soiled nappy or dirty nappy, or where they passed urine or stool and wet clothes are there. So that's uncomfortable. They tend to cry. Most of these reasons. Sometimes some babies, they tend to cry a lot without any apparent reason. Even they won't be feeding, and even after feeding also they continue to cry. So sometimes it may be difficult to establish the reason. And frequently what we see is middle of the night, parents come with apprehension, the baby is crying at home, but as soon as they come to the hospital, on the way, baby becomes quiet and settled down and they're happily playing in the hospital. This kind of a common experience for us and for the parents. I think sometimes it may be difficult to establish the reason, but whatever it is, I think once the baby settles down, that's okay. In situations where you're not able to console the babies are crying excessively, take help from your local pediatrician or a doctor. Some babies around second, third week of life may have excessive crying in the evening hours, especially as a pattern. And this is called colic, where they may be having some cramps in the stomach. So the various reasons for that, but nobody knows for sure what it is. But that tend to go away as the baby is growing. But if that continues, if it's a problematic, then we can give some medicines for the baby to get over that crampy pains. So another thing is massage and bathing. So you can gently massage the baby whole body, either with oil, without oil, preferably with oil. Then again, what kind of oil? There's no specific preference for any oil, but any gentle oil which is not irritable to the skin is fine. And you don't need to do vigorous kind of massage, gentle massage, but massage is not compulsory. It's only to help the baby to bond with the caregiver and have some time. And that also give a tactile stimulation for the baby to kind of expose to all kind of stimuli. But don't do a vigorous massage where it's painful, uncomfortable to the baby. And do not put any oil or anything into the nose or mouth, nose or ears, but it can be dangerous. And bathing, you can usually tend to club massage with bathing together. In babies who are low birth weight, we tend to say wait until they're reasonably good weight, especially in the colder days where the winter is coming up. Reason is just that they tend to get cold easily when they're exposed to environmental temperature, when the weather temperature is low. Otherwise, there's no contraindication for bathing the baby. So usually I advise tend to give bath in the probably middle of the day where the temperature is not that low compared to beginning of the day. And another common complaint I tend to see in my practice is babies having cold. I think I figured out what that means is noisy breathing and nose block what the babies have. Cold in terms of medical terms, what we use infection is probably less likely for the babies unless immediate caregiver has some infection. But otherwise, it's usually the nose block which is causing the problem. Because of that, sometimes babies have a noisy breathing, and sometimes you can actually feel a little bit of vibration on the back of the chest because of noisy breathing. That is because the normal secretion production happens in the nose or back of the nose, and babies will not be able to clear that. So to clearing on their own, they might not be able to clear it unless they sneeze or cough it out. So during that time, you may be able to hear some of noisy breathing, especially feeding time. If that is the problem, you put some saline drops if it is causing a problem with the feeding issues or breathing issues. Otherwise, you don't need to worry about that. And if you see any secretion, just squeeze the gently nose out and that secretions will come out. But otherwise, you can just put some saline nasal drops into the nose to help the secretions to loosen a little bit. Uh, Another issue is a jaundice. So jaundice, many people get worried about the jaundice in babies. So one thing I want to clarify is jaundice, what we get in an adult is entirely different compared to the jaundice what babies get. Adults get jaundice because there is a problem with the liver. Babies get jaundice because of two reasons. One is, when they're inside the mother, they have high hemoglobin to compensate for a low oxygen availability. But after the delivery, they're breathing like us, so they're more oxygen available, so they don't need that much hemoglobin. So that extra hemoglobin tend to break down, and that forms a jaundice. And second reason is the liver is immature, so it won't be able to handle that much. But that is not going to cause a problem itself. So all the babies, they get jaundice. There's no exception for that. And usually tend to start around second day of life, then tend to peak around third or fifth day of life. And by a week to 10 days of life, it comes down to normal. That is the normal happens. And not every baby needs treatment. So if baby is looking really yellow, and we usually do a test to check for the levels of jaundice. If it is above a certain threshold, then we advise treatment, what is called phototherapy. So we put them under a blue light where it makes it the jaundice pigment, which is called bilirubin, water soluble, so that goes in the urine. So usually if it's above a certain threshold, we do it, phototherapy. And there may be certain risk factors where the babies may have some exaggerated jaundice, what we call exaggerated physiological jaundice. So in those situations we generally typically where the mother and baby blood group is different. In those situations, it may happen, or baby is Rh positive and mother is Rh negative. In the blood group incompatibility situations, maybe the bilirubin may go higher than normal, we may need treatment. So in those situations, we proactively check for bilirubin on a regular basis. So that's why we usually tend to see babies after delivery. Immediately we'll check at the jaundice, look for any jaundice. If there is any doubt, we'll check it. But usually we see around again third or fifth day of life to see any jaundice. But majority of the babies, they don't need any treatment for these things. And for these mothers, do not need any specific diet in this thing. So they can eat normally, and diet has nothing to do with the jaundice with the babies. If you're in a doubt, then see a doctor to see if you're worried of anything. Then we can check it out and say, is it physiological jaundice or not? But majority of them, it's not a problem. The other thing, rashes. Newborn baby skin is very sensitive. So any kind of slight stimulus or insult, they tend to come up with a rash. Normally also they have more tendency for the rashes. Usually in the first 1 week of life, some of the babies may come up with a rash all over the body with pink kind of things with white heads. So if the baby is otherwise okay, there's nothing to worry about, and they'll usually go away. And sometimes some babies, especially in hot weather, they tend to come with a heat rash, especially on the forehead. So in those situations, you basically give them a good bath and apply some powders to keep it dry. So that will go away with the time. Yeah, another thing is a couple of things I want to kind of introduce, which is kind of a standard of practice in Western countries, and it's coming up in India. And some of the hospitals become a routine practice to do these things. And two things are newborn screening and hearing assessment. What is newborn screening is, we do a small blood test to look for any disorders which may not present at this age, but which may become apparent later. So you're kind of picking up these common disorders very earlier on, even before baby becomes symptomatic. So we do a small blood test to look for those things. And we usually again look for the common ones and where the early treatment is useful. So please get those tests done or ask for it if it's kind of not available in your where the delivery happened. Usually we tend to do it before the baby goes home or on third or fifth day when the baby comes back for a review. And another thing is hearing assessment. So hearing assessment has to be done routinely for all the babies before they go home to make sure hearing is okay. If there is any doubt, and then we'll tend to repeat that test again to see is it true or not. And if needed, then we'll do another test to confirm, called BERA test. But so this is again, if you pick up early, then you can do a lot of intervention so that their life can be normal without any disability. So hearing screening has become routine in some hospitals, even government side also, it becomes routine in some of the government hospitals. So if it's not available for you, if it's not done for your baby, please get checked. And if you are in doubt, please go to see a pediatrician so that they can help you with this test. Right, these are some of the issues we discussed. Well, there can be many other issues. If you have any doubt, please post questions. We'll try to answer that, or go and see your local pediatrician for the answers. But or you can come and see us at KIMS Hospital. Before concluding, just want to give another concept. When do you want to seek help, medical help? When as a parent you should worry about the baby? Anything is not normal, then you should get concerned, but especially so if the baby is dull or excessively sleepy and not waking up for feed, or the baby is irritable and inconsolable crying, or baby is not feeding well, refusing to feed, or the baby has any breathing difficulty or a fever. Any of these things, please see a doctor immediately. I hope this has been a useful session for you. As I said, if you have any doubts, please post your questions in the post, then we'll try to answer those questions. Or go and see your local doctor, please, if you have any doubt. Thank you very much.